Today we're going to talk about controlled articular rotations, or CARs, and I'm going to show you how important water can be as a medium to train your patients. Okay, so water is a very important medium, not just for CARs, but for any type of exercise. It provides a few characteristics that are very important. One being the hydrostatic pressure that it provides. That's very good for your circulatory system, as well as your respiratory system. Water also provides a medium for resistance, and then water is very important because of its buoyancy. So because of its buoyancy, we're not loading or we're not compressing the joints as much. So in the early phases of rehabilitation, you can use water, or you can immerse your patients in water to help unload or load very little, provide little loading to your patient's joints. So what we're going to do is we're going to start with hip CARs. We're going to do one for the lower extremity, one for the upper extremity. So we're going to do the hip, and we're going to do the wrist for the upper extremity. So let's take a look at how we do hip CARs underwater. Nothing really changes, so it's very similar to what we know so far. So we get our patient into the water, make sure that they hold on to the side of the surface, keep the one leg on the ground, okay, in the bottom of the pool, or touching the ground. And what you want to do is you want to raise the leg up, come over, make sure that, see how the knee comes out of the water? We don't want that. So make sure that you come deeper into the water. Okay, so we come up, come out, make sure that you irradiate, and come back around. Okay, let's do it one more time. So come up, come out, irradiate all the way around. So you can see that the water provides the resistance that we need. It has the buoyancy and the hydrostatic pressure. All are characteristics that we need for the exercise. If you want to make it a little bit more difficult, you can add certain aids. You could use a flipper, whether it's a long one, or initially you might want to use a short one, because that provides less of a surface area, so it makes it a little bit easier on your patients. And as they progress, you can move on to a bigger flipper. Okay, so we talked about the hips. Let's talk a little bit about the wrist. So for the wrist, a couple things that you want to remember before you start your CARs is you want to make sure that your elbow is stable, and you want to make sure that your elbow is not moving. So you don't want to cause any pronation or supination when you're doing your wrist CARs. Okay, so that's the first thing you want to remember. So two ways to do that. One is to make sure that you keep your elbow close to your body. Second thing is that you want to keep your, I usually keep my other hand on top of my forearm, so I check for any rotation, any supination or pronation of the forearm, and I make sure that I remind myself to not do that. Dewey Nielsen, in one of his videos, had a great way of doing that. You want to put an item onto your forearm. He used a cell phone, and when you do that, you want to make sure that the item doesn't fall off your forearm. So you want to make sure that you keep your elbow tucked in, make sure that your forearm doesn't supinate or pronate, and then what you want to do is you want to create your CARs. I'm going to show this underwater in a little bit. Create rotation into your wrist, keeping a fist initially. Then what you want to do is you want to open up that fist. That causes an increased surface area. That makes it a little bit more difficult in the water. And the last thing that you want to do is a couple more things actually. One is you want to open up your fingers. That causes even a bigger surface area in your hand. That makes it even more difficult in the water. And the last thing you can do is use a flotation device. So when you use a flotation device within the water, that also is going to make it a little bit more difficult to create that movement. Okay, so that's a gradual progression of difficulty for doing CARs, wrist CARs in the water. So let's go ahead and demonstrate that.